the Daily Dose with Dr. Melissa here. How are you doing this morning? It's a beautiful morning today. So we are going to talk about ACE inhibitors today. So I thought I would do a series on some common medications that you might be taking based upon what you're doing today. So ACE inhibitors are a class of medication it's an angiotensin converting enzyme. And an inhibitor, of course. So what that does is that acts in your body to inhibit the process of angiotensin. And what you might be on these medications for is most commonly, you're on these medications for high blood pressure. So this is one of the first lines of medications that, depending upon where you are when you're diagnosed with that condition, you might be put on. And you might be wondering, well, why am I put on this medication? And so it's very helpful to know why you're on something. That's key. I want to empower you to know why you're on something. So kudos to you for knowing that why you're on an ACE inhibitor. And some things that an ACE inhibitor does, of course, is help lower your blood pressure. Sometimes it might be beneficial to be put on an ACE inhibitor, depending upon where you're at with some kidney challenges, especially if you're diabetic. You might have been placed on an ACE inhibitor for that. There is other reasons. If you have other cardiac issues, such as heart failure, then an ACE inhibitor might be important for you to take as well. And so knowing about an ACE inhibitor is one of the first steps. And so I just want to give you some information that sometimes medications are necessary and sometimes they're important until we work through and get you to an optimization of where you need to be. But if you're on an ACE inhibitor, you might be experiencing no side effects, which is great, and you might be experiencing some. And if you are experiencing side effects, then we need to talk so we can figure out what is the best thing for you. And maybe an ACE inhibitor is not the right choice for your condition, okay? So most common is a dry cough that just won't go away. Several people in the studies have reported that, and I've had several clients who've reported that. And what we've done is we've switched we've talked to their physician, and we've actually gotten them to switch different medications based upon their side effects, okay? Sometimes ACE inhibitors can make you really sleepy, cause what's called fatigue, get you really tired. It can also cause a headache. So those are some of the ones. And of course, since it's lowering your blood pressure, it can actually make your blood pressure go really low. And so it's very important that if you're taking a blood pressure medication, that you monitor your blood pressure on a regular basis, okay? And that's so we know how you're doing when you're not in our offices. That's how we know how you're doing. You can report your numbers and we can figure out, is the medication working? Is it not working? And so that's just a few tips on why you might be on an ACE inhibitor, some things that could happen with an ACE inhibitor. And if you have high blood pressure, then that's most commonly why. So I thought I would just bring you just a snippet of information about some different medications over the next few weeks, sprinkled in with several guests coming on. So tune in, stay tuned. We'll be talking more about medication and how it affects you and how the best thing is for you. So if it is to optimize what you're taking and you want to go more holistic, then let's chat, okay? If you want to reduce the level of medications that you're taking, let's chat. All right, so it's the Daily Dose with Dr. Melissa. Have a fabulous, fabulous day, and we will catch you next week. All right, bye-bye.